Welcome to Pawsitive Health, where we believe pet owner education leads to better pet health. I am Devlin. This is my co host, Dr. John Adam. And on this episode, John, what are we talking about today?
Today we're talking about one of the three main allergies, and that's environmental allergies, which we call atopy. Out of the three, this is probably the most challenging allergy because there's no cure to it, and it takes usually multiple things to manage it as well. And that's a big misconception and a lot of misunderstanding in the vet clinic about this. So it leads a lot of frustration to not only us as veterinarians, but to clients as well.
Okay. So you said atopy?
Atopy.
Atopy.
Sorry.
What does atopy mean?
Atopy. So atopy means environmental allergies, right? What we call atopic dermatitis. So atopic dermatitis is an allergy of the skin, usually driven by environmental allergies such as pollens or dust, mites, mold. It's partly genetic. A lot of these breeds, such as Labs and Goldens, Frenchies, Westies, Bulldogs, Sharpays, but honestly, any dog, they'll have a skin barrier defect. Because of this, the allergens will get into the skin barrier and then cause a reaction, and hence starts their allergic flare-up. Usually starts about 6 months to 3 years onset. Usually I see it past a year. Honestly, it can start anytime. And the usual signs of it are licking and chewing their paws, recurrent ear infections, rubbing the face, scratching, itching, chewing at their armpits, their belly, their groin. It can be seasonal, although in most areas, especially here in Southern California, there's not much of a season. It's year-round usually because the allergies are around year-round. So that's kind of the gist of allergies for you.
Okay. Well, I mean, I know with Loki, with my dog, like it's with his like white fur, it's really easy to tell when he's been licking because his fur gets all different colors. So that's like a quick easy sign if he's not licking right in front of me that that he's been itching more. But for us, we've, like a lot of pet parents, like food was a factor for some things. But when we were trying to figure out what food it was, like we're going like, all right, is this food? Is it this food? Is it this food? Is it this food? And eventually, it's not one singular thing. It's a culmination of different things.
Yeah,
which means
be that.
Yeah, which means there's no single cure, or is there a cure?
Or a management. There is no cure, unfortunately. I mean, at least with food allergies, you can not feed them their allergen. With fleas, the other big category, you put them on a very good flea control or flea preventative, and majority of times that will take care of it. With environmental allergies, fortunately, it's around them all the time, so you can't completely get rid of it. But we try to manage that and manage the flare-ups as best we can and manage the secondary issues that we get from it as well. But the key, like I said, is that this is a lifelong condition. The goal isn't for it to completely go away, but to just control it as best we can, limit the amount of flare-ups they get, and limit the amount of secondary infections that they get from the allergies.
Got it. All right. Well, you said that like the skin barrier is letting stuff in. So like, if he's allergic to dust, is there now dust in his bloodstream?
It doesn't necessarily go in their bloodstream. It's just there's immune cells that sit underneath your dermis that get triggered when they see foreign material that go through that skin barrier. And over time, that develops into a hypersensitivity is what we call it. And whenever we see, or the body sees that allergen again, it reacts and then causes further inflammation, further disruption of the skin. That in turn causes a vicious cycle where the allergens are more capable of going in. And so it's just a cycle that we try to break with our treatment.
Yeah. And I know, like a lot of pet parents, I have definitely had moments where I felt like I was failing my dog just because, like, it seems like no matter what I try, sometimes like it's always an issue. So, what is it? I know you and I have talked about it, but for our viewers, what is the best way to start managing it?
And it starts with a conversation with your veterinarian, honestly. And with that, your veterinarian is probably going to have three goals in treating atopy or allergic dermatitis, environmental allergic dermatitis. And the number one goal is when you come in, most of the time, you've already started secondary issues like infections, ear infections, skin infections. And so we need to control that because that's going to complicate things, cause more itching. That sometimes causes more itching than the actual allergy. And so we want to take care of that, get that under control. And then after that's under control, then we focus on trying to take care of that allergy. The next thing is obviously control the itch, the main thing while you're coming in. And with that, there's multiple different treatments that we could do. A lot of times we have to use more than one, but that's our second goal. Our third goal is, since the allergens are going through a broken skin barrier, we want to try to fix that skin barrier. And we usually do that with, once again, certain treatments that are a lifelong treatment. It's not something that's a cure, once again. It's a lifelong treatment to try to keep that skin barrier as intact as possible so that we hopefully will limit the allergens getting in and causing that allergic response.
Now, for myself, like I've been dealing with eczema for the vast majority of my life, and it didn't start, from birth. It showed up later on, like a lot of allergies do. It just happens to pop up. But a lot of my non-managed solutions, like the medicated solutions, they can be pretty damaging to the skin over time. Like if I'm using a steroid cream for a while, it's not going to work that great, or it's going to cause damage to my skin. Is that the same concern with our pets?
Absolutely, it's the same concern. We do have similar treatments that we used to use, and we still do use them, but not as much. But things like steroids and other things like that, and they can cause long-term effects that a lot of times we try to avoid. And thank God we have newer treatments nowadays that are not as harsh on the body and are very effective. And it's been kind of in the past, decade, a little over a decade, we've been getting these new treatments for atopy or allergic dermatitis, and it's been great. Before we had to rely on medications that can affect the body more so, and now we've got better treatments that also honestly work better as well. So they're great to have. And so I'd like to kind of go over a few of them. One of the newer ones called Cytopoint. So Cytopoint is an injectable monoclonal antibody. So what that is, we're basically taking a page out of the immune system. The immune system takes these antibodies to mark cells or viruses or bacteria being targeted for the immune system. In this case, we're using it to target a specific molecule called IL-31, which is a messenger molecule that starts that itch signal to the brain and to the body. to initiate that. And so once it binds to the molecule can't bind to its receptor where it's supposed to go to start that signaling. And so it inhibits it from doing that, hence the itch cycle goes away. This takes usually a few days after the first shot. But after that, as long as you're on a routine every 4 to 8 weeks, usually 4 to 6 weeks of giving this injection, you can have relief from the itching. Very safe, just like your own body disposes of these antibodies. It's the same thing. It's disposed in the same pathway. It's very natural and very safe. There's really not much side effects to this medication, and not much contraindications in giving that medication either.
Is this something that you have to give, or is this something that we do at home?
Yeah, so we do that. It's an injectable medications that us at the clinic we would do. As far as at home, there's another medication that is a newer medication, not as new as Cytopoint. Apoquel is probably the main one we think of, the JAK inhibitors.
Right.
The other ones that are out now are Zenrelia, and there's Numelvi as well, that's newer. These are more selective JAK inhibitors. And with these medications, they block a signaling pathway in the cell that once again causes the triggering of the itch cascade, but also inflammation. And this will inhibit that, and once again inhibit that itching. It does dampen the inflammation, hence dampens the immune system a little bit. So it's not technically as safe as Cytopoint, but it's still relatively safe. I sometimes will use this medication along with Cytopoint, especially if we're using Cytopoint for the first time, because it acts really quickly within hours. And I will use it temporarily until the Cytopoint kind of kicks in, and then use that as my long-term treatment as long as patient's doing well with it. Sometimes we have to use the JAK inhibitors because they don't. Some dogs don't do well with the Cytopoint injections, or sometimes we have to use both. A lot of dogs, we have to use both medications in order to control that itch cascade.
Yeah.
Go ahead.
I would say, so if you don't manage it, the bigger danger is the secondary infections that you were talking about then.
Yeah. So if you're not managing the itch causes trauma to that skin barrier. Trauma to the skin barrier promotes the opportunistic bacteria and yeast that are on the skin to cause that infection, and then you're causing more itch discomfort because of that infection. So we want to try to limit that as best we can so we don't get to that point.
Got it. Is that what causes his paws to smell like Fritos sometimes?
Yes, it can be in like an overgrowth of yeast that caused that. Another medication, it's an older medication. I don't use it as often, but still is in our repertoire, is one called Atopic or cyclosporin. It's an immune modulating drug, so it dampens that immune response once again to the allergen. It's very slow in onset compared to Cytopoint and Apoquel. It takes up to a month, sometimes a little longer, to finally kick in, and can have some issues, some side effects, such as GI issues, vomiting, although sometimes we tell people to freeze the capsule to limit that, or we put them on an anti-nausea medication. It can cause gum issues, something called hyperplasia, overgrowth of the gums. It can affect their liver. Obviously, it's affecting their immune system, dampening their immune system, so we have to be careful if they have any concurrent infections, that we want to make sure to take care of that. It's still a great drug. A lot of our patients are on this still, and we use it for other things as well, but it's a great drug for allergies.
Yeah, I mean, I think we've used it off and on for some of our pets over the years.
Atopica. Yeah, I mean, before JAK inhibitors, before Cytopoints, this was a great drug to use to spare them from the big gun, which is steroids.
Yeah.
And a lot of times it worked pretty well. Just there were some patients that didn't tolerate well or had issues with it. And so one of the other treatments I like to use for allergic dermatitis or atopy, and this is my favorite treatment option, is topical therapy. So using things like medicated shampoos, medicated mousses, and conditioners to help not only wash the allergen off them. So during a bath, you're physically washing the allergens off them, but you're using ingredients in the shampoo that are antimicrobials, such as chlorhexidine or ketoconazole or miconazole. They also have ingredients to repair that skin barrier. So that's one of the big things, like I mentioned before, that we want to do is repair that skin barrier. And they'll have things like ceramides, phytosphingosines that will help repair that skin barrier so that we hopefully won't have those allergens breaking into the skin barrier and causing the reaction. And once again, you're also helping fight overgrowth of bacteria and yeast because of the antimicrobials that are used in these shampoos as well. A lot of times we'll also use the mousses and conditioners, especially the mousses, where if you need spot on treatment, like they just have issues with their paws, so you can just kind of rub it into their paws instead of doing the entire body. But a lot of times we'll kind of use both, use the spot on treatments in between our baths. Usually we like the baths once a week, sometimes more so. And with these type of shampoos, you can use them more than once or twice a month. Honestly, you could use them every day and you won't have an issue with drying their skin or having any other issues with the shampoo and their skin. It actually helps repair that skin. For ears, we like to have ear washes. I like to do it usually a couple times a week just to keep the ears nice and clean and dry, help fight any, once again, overgrowth of yeast or bacteria, to help with taking care of those ears and keeping them clean and bacteria-free, yeast-free. Another natural supplement that we use a lot, this is one of my favorite supplements, omega-3 fatty acids. They're amazing and natural anti-inflammatories. They also help repair the skin barrier. One part of the skin barrier is the lipid layer, and so the omega-3s are put into that lipid layer, and so it will increase the integrity of that lipid layer. Can take a bit of time to kick in, usually a couple months, and so you have to be patient with them, but they're a great tool for allergies. And I always tell people in general, I even start them in young puppies to give them this supplement because it's not only good for allergies and their skin and coat, but it's great for their joints, great for their heart, their eyes. It's just a great natural supplement to give to your pets. So I always recommend omega-3 fatty acids, even though you may not have an allergy issue at this moment.
Yeah, one of the couple of things about that we've had, we were using a liquid one for a while there, and his coat was so much shinier and softer. That was a plus. I will say our viewers are going to want to know that when you start these things, your dog is going to start permeating the smell of fish oil, depending upon which one you're giving. But it's not bad. It's not unpleasant. But if you want to be the good parent that we all want to be, you got to do these things.
Yeah. And that's one thing you want to make sure to get a vet formulated omega-3 fatty acid, because for one, that absorbs better in their gut, but also you will get the fish smell from some of the supplements, while there are ones out there that are formulated well where you don't get that. I have one that I use, coalactin, for my own pets, and they don't have that issue at all as far as the fishy smell. But they love it. They'll take it right off the spoon if I could
Nice.
just give it to them straight. They usually just pour it in the food and they eat it right up, and they do great with it.
For the one that we used, the issue that I had with just giving it to him in general was it seemed like when I would squeeze the bottle a little bit, like it would just shoot out.
Mm.
It was the one that starts with an M. What's that one?
Starts with an M. I'm not sure.
Yeah. But yeah, that was the only thing. So I was doing, I had to learn how to, pour it into a larger container before I then would, put it onto the food. Because if I just went straight on the food, sometimes it would like splash out onto me. And then my coat would smell like fish. It wasn't great. I don't recommend that.
It didn't come with like a little measuring cup or anything. It just, you had to spray it on.
Yeah, but it like just a little squeeze and it would just shoot out of that whole thing. It was almost like it wasn't pressurized, but it would come out like it was pressurized. It was not fun. Not fun. So for people, one of the things that that's done is like lotions with CBD. I know that's going to be controversial for some because of the implications, but it works. I've used it for myself, and in times when I've had extreme flare-ups, it works. Is there a solution like that for our pets?
As of right now, there's no definitive CBD product that can help with allergies. That may change in time, but as of right now, there's no effective CBD or THC product that we can recommend that helps with allergies. So
don't experiment on my dog, is what you're telling me. I don't need to experiment on my dog.
I wouldn't recommend it. I mean, it's your dog. You can talk to your veterinarian as well and see what they recommend. But I would probably not recommend that.
Well, you're my veterinarian, so
Yeah. So don't do that.
Yeah. Okay, I won't do that. Save it for myself. Here, hold on one sec. So I was talking about with paws, so I could show people right away. So it shows up on camera, but his paws are normally white. He's been having a flare up. So right here, it's a little bit sort of rusty colored on him. So that would be what I look for.
It's the saliva staining on his fur. So that's what causes that red rusty tinge on their hair coat and around their mouth or wherever they're licking. Honestly, so
you said like a mousse for like spot treatment kind of thing. If I use that on him, like I've noticed a lot of times, like after he's had certain foods or if he's been outside, he comes out and he like rubs his face everywhere, like trying to rub. If I use it on the face, is it safe like around the face to use the mousses? Because
it's safe. Obviously, you don't want them consuming it, but around the face, keep it away from the eyes as well when necessary. Want to have it near the eyes, but around the face, it should be fine. You just kind of rub it in. Just don't be squirting in their mouth or in their eye. Probably wouldn't recommend that.
Yeah, he would agree with you. Yeah, no, he would agree with me. So what? So let's see. We got possible shots that we need to do. We've got drugs like Atopica and Apoquel. Was that the other one?
Yeah, the JAK inhibitors, Apoquel, Zenrelia, Numelvi.
Yeah.
There is other treatments as well. One treatment that they do in people a lot as well is allergen-specific immunotherapy. So this is where we do their allergy test. We either do a blood test or we do a skin test, and we determine what their allergens are. Usually there's going to be multiple of them. And from that, we'll take that and put it into a sublingual drop or a shot. And that will hopefully, over time, we just slowly introduce them to their allergen, small amounts of it, that hopefully over time their body's like, you know what, this isn't so bad. And they become more attuned to it. They don't react to it as much. And so hopefully this will spare the amount of drugs and flare-ups that they have. And this is probably the closest thing to a cure. It's not a cure, though. You're still going to have allergies. It's just hopefully going to dampen that immune response to the allergen, and just have the body get a little more used to it. This can take a long time. You're still going to be doing your general treatment for allergies. Usually they say 6 months to a year. I'd say at least a year before you can really see an effect. About 60 to 70% of dogs respond to this treatment. But sometimes if you got a dog that you do everything else and just still isn't enough, a lot of times we'll start this to hopefully try to desensitize them to those allergens so that when we do treat them, it will hopefully be optimal as far as keeping them comfortable, taking care of those secondary infections or preventing those secondary infections.
Okay. And the treatments, they don't have any interactions with like when he gets his, vaccines for stuff, right?
As far as vaccines, no. You may actually get an actual bad allergic reaction from them. It does happen because usually you start with a low concentration, then you kind of work your way up. And when you get to a higher concentration, sometimes the body's like, well, that's a little much. And they might get an allergy flare from it. But it's not often. And when it happens, you just take care of it. And then hopefully, like I said, their body will start getting used to it.
Okay. So still pretty safe.
Yeah, it's pretty safe. And our final big treatment is steroids. Steroids are amazing. I use them every day. Not for myself, for the dogs and cats. But
you're looking pretty swole there, John. I don't know.
Right. But they're a great option, especially short term. The problem is, especially long term, they have a lot of side effects, including increased panting, urinating, drinking, weight gain, immunosuppression. So it really dampens their immune system. And it honestly affects every tissue cell in their body. So it affects their kidneys, their liver, their bones, their tendons and muscles and all that. So long term, it can cause a lot of problems. So we try not to. Now there's some dogs and cats that's the only thing that's going to work. And so we'll use it, and we use it with caution, and we monitor their blood work and just keep an eye on them as much as we can so that we don't see any of those secondary effects of steroids. But short-term wise, though, I use it a ton just to kind of stop that flare in its tracks while everything else can kind of kick in and take care of everything long-term.
Okay. Let's see. I mean, we were. Is there anything else that we're missing that we're looking to go over with this? I mean, we talked about what it is. Kind of like a inverted situation with a tea bag, right? Like you don't want, because a tea bag, for the skin, right?
Please explain.
Okay, so like if a tea bag was meant to keep all the tea inside and not let anything into the water, like the water is us, right? That's on like a reverse one, right?
Okay.
So like the tea itself is the allergens. We don't want it to pass through the barrier of the bag into the water. But as more allergens get through and pass through, they're basically just opening up those little tiny holes, and then more can pass through into
the
water.
allergen causes that inflammation and immune response, and then that damages the skin even more. And then you got damaged skin that can't protect against those allergens as much, and it's just a vicious cycle. And so you try to break that cycle and try to repair that skin barrier. That is our goal.
Is it ever bad, like with humans and peanut allergies, where we need like a doggy EpiPen?
There are certain allergens out there that can cause major reactions. Now, usually with environmental allergies, it's not that bad, but there can be cases of allergies out there, such as insect bites or bee stings and stuff like that, that can cause a pretty severe reaction where you need to bring them into the hospital as soon as possible. There are dogs that can have that issue for sure.
Okay. So, I mean, there's a decent amount of tools to use to fix this.
Yeah, we have a lot more tools than we did, like I said, a decade ago. And so they're nice to have. The big thing with pet owners, they just got to remember this is a lifelong thing. You're not curing it. It's going to take multiple different types of treatments to take care of it. So be patient. Be patient with your veterinarian. Your veterinarian's going to be patient with your pet, and eventually you'll get it under control. But it does take some patience and time and effort from pet owners on their end. So please don't try to stop something because it's been working. So, everything's fine and dandy. Don't do that. You do want to keep up with the allergy treatments because allergies never go away.
Fair point. All right. I think that's it.
All right. So yeah, and a great video on allergies. Thank you for joining us today. Once again, I would like to promote our little school community here. So we have this community, Pawsitive Health, where you can join and ask me specific questions about your pet and your pet's health. Once again, like these videos, these are just for informational and educational purposes only. Same thing with this community. We're here to educate, not give a diagnosis or a treatment plan. That is what your veterinarian's for. But if you ever wanted to get more information about your pet's health, you can always join this community. We will do routine live Q&As where we can answer the questions that you have. There's like I said, a little discussion board that you can post your questions as well, and we'll get to them as soon as we can. There'll be resources there and much more. So it's just a more hands-on community to help better educate you guys on your pet's health.
Nice. Well done.
Well, thank you very much, everyone. And if you found this video helpful, please like and subscribe. And if you have any further topics you'd like us to discuss, please comment down below, and hopefully we can get to them.
Or comment here in the Pawsitive Health.
There you go. All right, come into the community and comment there. Probably get a quicker answer there.
Yeah. Incentive. Till next time.
Till next time, take care and be safe.